You are welcome to our YouTube channel today. Now we are going to discuss about diet in a diabetic patient. So patient with diabetic mellitus type D, they are a special diet regimen that they are allowed to take so that they will keep their blood sugar in the normal range based on the diet they are taking, but also you remember to take your medication, your diabetic medication as prescribed by your consulting medical doctor. Now we are with Dr Gasangwa Patrick, who is going to talk with you about the food regimen for diabetic patient. Either you have a type 1 or type 2 diabetic mellitus, there is special diet you are gonna to take. If it is your first time you are gonna to watch our YouTube channel, remember to do subscribe so that any video we put in our channel in the future you will see it as it reach there on time. So a meal plan is the guide for either when, what, and how much to eat to get the nutrition you need while keeping your blood sugar also levels in the target range. A good meal plan also will consider your goals, tasks, and lifestyle, as well as any medicine you are taking. And also, once you are diabetic and you are taking a good meal plan, this will also include the more starch vegetables such as green beans, broccoli, and others. Also include the fewer added sugars and refined grains such as white bread, rice, and pasta. Also have to focus on whole foods instead of high processed food as much as possible. This is like to mean that those industrial food, they are not good for the diabetic patient, because most of the time there is added sugar in those industrial food that those sugar will not be good for a diabetic patient. And as we know, if you have a diabetes mellitus, you are not allowed to take food unless food rich in sugars, unless you have low sugar that is known as hypoglycemia. Otherwise, you have to avoid sugars in your food. So the best and easy method for food regimen for any diabetic patient is to use the Pareto method. The Pareto method. This is like to mean the plate you are taking, you have to divide it into like 3 quadrants. There is 1/2 which is rich, and the 1/4 and another quarter. Those 3 sides will allow you to get good diet. For example, the first half of your plate will include the non-starchy vegetables, and another 1/2 will include protein foods, and another 1/4 will include carbohydrate foods. So it's easy to eat more food than you need without raising it. This is why it is important to use that Pareto method. So Pareto method is simple visual way to make sure you get enough non-starchy vegetables and lean protein while limiting the amount of higher carbohydrate food you eat that have direct impacts on your blood sugar. So you take or you fill the half of your plate with non-starchy vegetables such as salad, green beans, broccoli, cauliflower, cabbage, and carrots. This is like to mean the half of your plate will include regime simple. Those salad, they are regime, green beans, broccoli, cauliflower, cabbages, and the carrots. Those are regime. So this, you put this in the half of your plate, the plate you are taking, it will help us to get good regimen. Then fill a 1/4 with a lean protein. This is the quarter of your plate to include the protein such as chicken, turkey, beans, tofu, or egg. And remember that diabetic patient it's better once you eat those white meat instead of red meat. Then fill another quota with carbohydrate foods. Those are foods that are higher in carbohydrates, and this include grains, starchy vegetables such as potatoes and peas, rice, pasta, beans, even those yogurt. Even a milk or a cup of milk also will include in that carbohydrate food. As a summary, you take a half of your plate and put legumes such as salad, green beans, broccoli, cauliflower, cabbages, and carrots. Then you take another 1/4 with lean protein such as chicken, turkey, beans, tofu, eggs, and even fish. And then you take another quarter of your plate and put foods rich in carbohydrates such as grains, starch, vegetables like potatoes, rice, pasta, beans, fruits, and yogurt. Even milk, a cup of milk should include there. Then you have to add to your plate, you have to take like water as needed. There is even a low-calorie drink such as unsweetened iced tea to go with your meal. You can take water, no problem. Water is good for diabetic patient. So this is how your plate should be organized in a diabetic patient every day. And after that, avoid consumption of alcohol and even avoid food rich in sugars, and also do regular exercise if you are able. This will help you. And remember to consume raw salt and also take water, drink water. And I think this will help you to control your blood sugar, and even remember to take very well the drug you are taking that was prescribed to you by your daily consulting medical doctor. Thank you very much for watching our video, and I think it is very helpful for any diabetic patient who need to know how is gonna to organize her or his diet. So I wish you to take healthy diet and healthy life. So remember to do subscribe to our YouTube channel so that any other video I will put to my channel will be available to you immediately by notification. Thank you very much.